Since the start of the pandemic, more than 150 complaints have been filed against Washington doctors for COVID violations. So far, only one has been disciplined.
Last month, the King 5 investigators exposed a doctor writing COVID vaccine exemptions with no exam or medical questions asked. Now, Chris Ingles reveals why state regulators may be failing to uncover the problem doctors.
There's a lot of fear. There's a lot of anxiety. There's a huge push by the government and the media to keep people scared and a lot of times misinformed.
Dr. Anna Elprin didn't hide her opinions when we interviewed her in November.
So to me, this is a scamdemic.
This is what she's not so open about. We sent journalists on 4 separate visits to her Ellensburg clinic.
It was $200 for the visit.
Undercover cameras recorded her signing COVID vaccine and face mask exemption forms without conducting a medical exam.
She didn't ask me any questions. We didn't go over my medical history or any medical condition I might have.
Patients submit these medical waivers to employers to avoid state vaccine and mask requirements, a process meant for the small percentage of people with legitimate medical conditions. We obtained this exemption to excuse a city employee from wearing a mask through a public records request to the city of Ellensburg. It was signed June 3, 2020, indicating Dr. Elprin has been writing exemptions for almost a year and a half. Former employees at her clinic told us she signed hundreds more since then.
It's an abuse of the system, and really, it's almost unforgivable.
Dr. Colina Koltai is a nationally recognized expert based at the University of Washington.
Basically, a lot of what my job entails is researching the anti-vaccination movement on social media.
Much of her research at the UW's Center for an Informed Public is focused on COVID misinformation, like headlines and fake news stories that are spread online. But she says misinformation from a local doctor, like Dr. Elprin, is an even greater threat.
It's almost immeasurable, the power that comes from listening to a local doctor, because imagine this someone in your community, that's not someone far off. It makes it seem more tangible. How many doctors are there? Even if you have 20 doctors in the state that are signing it, they can do real harm to the health of Washington.
Our investigation shows the state is failing to identify the doctors who pose that threat. In Ellensburg, we spot-checked a handful of public agencies and found 25 exemptions written by Dr. Elprin alone. But the state isn't compiling data on which doctors are signing exemptions, even at public agencies, so it can't monitor those doctors writing excessive numbers of waivers.
They feel like they're able to get away with it. There is no stopping it.
Are you running a vaccine exemption mill here?
No.
Where you're taking payments and signing exemptions with no questions asked?
Absolutely not.
Records show at least a dozen COVID-related complaints filed against Dr. Elprin. She's under investigation, but still practicing.
The thing about medical boards is they are reactive.
Professor Ross Silverman is a medical ethics expert who says Washington medical boards, like many other states, rely on complaints, usually filed by patients, to identify problem doctors.
They don't do preventive regulation. They tend to be reactive to complaints that they've received.
But even then, there are few results in Washington. At least 158 COVID-related complaints have been filed against doctors and physician's assistants in our state, according to our review of State Department of Health records. Scott Miller, a physician's assistant in Washougal, is the only one whose license has been suspended. Just one provider disciplined nearly 2 years into the pandemic.
We have to drive this pandemic into the ground.
The Office of Governor Jay Inslee, who ordered vaccine and mask mandates, isn't calling for more scrutiny. We think the policies in place now for identifying fraud are appropriate under the circumstances, which are to get as many people vaccinated as possible in an emergency situation, a spokesperson said in a statement.
I think vaccine misinformation and COVID misinformation is here to stay.
Critics say states like ours aren't doing enough.
Our government and our resources really need to go and try to tackle it. It indicates that we do need to start putting more scrutiny on it so that we can put faith back into the system.
Both the State Department of Health, which investigates doctors, and the Washington Medical Board, which hands down discipline, turned down multiple interview requests from us. They believe there's only a small percentage of doctors that'll do this kind of thing, but it's really not a small matter when dangerous health misinformation is coming from, of all places, your doctor's office.
Chris, I'm sure the Department of Health doesn't want a doctor to get away with something like this. I mean, what kind of explanation do they have right now?
Yeah, Greg, I spoke to State Representative Monica Stonier, who sits on the House Healthcare Committee. She says she's disturbed by what our investigations uncovered, but she has pointed out an important thing, that health departments are really overwhelmed right now with all the facets of the COVID pandemic, public education, inspections, investigations, and on. But she does plan on talking about the weaknesses we've uncovered in our stories with her fellow committee members to see if there is something that can be done.
All right, a lot more to come on this, I'm sure. Chris, thank you.